Hi, everyone. Welcome to our annual Public Health Graduate School panel. My name is Elisa Crossman, and I'm an undergraduate advisor in the Herbert Wertheim School of Public Health. We will be hearing from a panel of 5 current and just graduated graduate students in a variety of health-related programs tonight. I want to encourage you to use their answers as a starting point for your journey into researching the graduate programs and career paths that are the best fit for you. For more information about graduate school, visit the Public Health website. You can start researching graduate programs at the Planning Your Future tab at ph.ucsd.edu/undergrad. Our panelist information and contacts can also be found on our website on our news and workshops pages. I want to remind you that today's event will be recorded and will be available on the Public Health website following the event. First, I would like to ask our panelists to introduce themselves. Please tell us your name, your degree, area of focus in public health and school, future career plans, and a little bit about your graduate school experience. Why don't we get started with Dmitry?
Hello, thanks for joining us tonight. My name is Dmitry Gonzalez. I went to UCSD for undergrad, where I studied public health and microbiology. I am currently in grad school at UCSD for my MPH and also my MD. For concentration, looking just at general preventive medicine in the future. For career plans after finishing medical school, I hope to enter either a pediatrics or family medicine residency and eventually perform a fellowship in preventive medicine and then long-term work with underserved communities either here in San Diego or back in the Central Valley.
Excellent. Natasha?
Hi, everyone. Welcome. I am a second-year postdoc at UCSD, UC San Diego and San Diego State University. I started my undergrad actually in medical anthropology, and I did my master's in public health with a focus in epidemiology and health promotion. And then I did my PhD in interdisciplinary research in substance use. So it sounds like a mouthful, and it is. It's a program, a doctoral program that focuses a lot on public health, so a lot of epidemiology, health promotion, but we specialize in substance use and how that impacts adults and children in different fields. And now my postdoc is in neuroscience, and I look at neurodevelopment in children who are exposed to alcohol and other substances in utero. So as you can see, I've had a very vast, diverse educational career, and the master's in public health was the one thing that really propelled me into this PhD and postdoc, and I learned the most valuable skills in that MPH.
Thank you. Melissa?
Hi, everyone. Welcome. My name is Melissa Lopez, and I graduated from UCSD in the spring of 2021, so just 5 months ago, with a public health degree and a business minor. I'm currently a first-year master's student in health administration at Cornell University. I grew up in Southern California my whole life, so this is like my first time away from home, so it's been pretty scary and a good experience. After I graduate in this program, I want to pursue an administrative fellowship, which is a 1 to 2 year rotational program that bridges, hospital administration with finance and human resources. So far, I would say that my graduate experience is going very well. I'm very busy with classes, and I'm searching for a summer internship, so that's been on my radar.
Oops, it helps if I unmute myself. Thank you. And Sanjana?
Hi, everyone. My name is Sanjana. I'm a first-year Master's of Science in Public Health student at Johns Hopkins University. My area of focus is health education and health communication. I actually didn't study public health when I was an undergrad at UCSD. So that's a pretty interesting way of how I came to public health. I studied sociology and molecular biology, and I really wanted to gain a better understanding of health at a population level, which is why I wanted to pursue a master's in public health. I aspire to be a physician, but I still wanted to get a degree in public health to gain a holistic understanding and ground myself. And I'm really interested in health literacy and patient adherence.
Wonderful. And last but not least, Brianna.
Hello, everybody. My name is Brianna. I'm a student in the joint doctoral program through UCSD and SDSU. A little bit about my background is I got my Bachelor of Science in Biology at the University of Notre Dame. And there I originally had the intentions of going to medical school, but through some experiences on TIMI Global Health, which is an international medical brigade organization, I found public health, and that kind of really steered me away from pursuing medicine, and I haven't stopped working in public health since. I went on to pursue my Master of Science in Global Health there at Notre Dame as well. Worked for about 4 or 5 years in clinical research at different research institutions. And now I'm here doing my PhD, mostly focusing in environmental health research, looking at the effects of pesticide exposure on cognitive development and also mental health outcomes in adolescents.
Wonderful. Well, it's so wonderful to meet all of you. Thank you so much to all of our panelists for being here. So we'll get started with some of our questions. And to all of our attendees, if you do have questions for our panelists, we just ask you to hold on to them until the end. We do have some questions that were sent in for the event by some attendees, but we're more than happy to try and address as many questions as you have. Just go ahead and hang on to your questions until the end of the event, and then we can use the chat or perhaps have you unmute yourself if you feel comfortable with that to answer your questions. But right now we're going to focus on some questions that we have already prepared for the panelists, some of the questions that came in a little bit earlier. So we appreciate your understanding with that. So panelists, the first question that we have is kind of a doozy. I know that we had been discussing this before the event began, but I think it's a really important one for our students to hear. Perhaps, Brianna, you can get started with us with answering this question. The question is, why did you choose a career path in public health? What drew you to the field, and why do you feel passionately about it?
Yes, of course. So kind of a little bit is what I was mentioning in my introduction is when I first started my undergraduate work and path, I had the intention of, or the goal of going to medical school initially. And as a part of that, I definitely really aligned a lot of my coursework along those lines and getting some clinical experience. And along the way, it was through my extracurriculars that I really became aware of what public health was and the potential impact that it could have both on domestic populations, but populations abroad as well. And through that, through my I was part of a club called TIMI Global Health, and a part of that was they ran medical brigades to Quito, Ecuador over the fall semester or fall break at the university. And we were involved in all different aspects of that. And basically it was a week-long trip where we went to different communities to help provide some medical care. And they tried to do it in a sustainable way that also had a referral system back to the local medical system in the area as well. And really through my involvement through the planning process, through raising funds for the different medications that we were bringing down to the area, to even working with the different populations there, I did have the ability to serve as a translator for both our doctors, but also for our community partners there. So I really had that one-on-one experience. And I really understood the impact that these public health interventions could have. And I just wanted to learn more. And that's why I decided to pursue my master's in public health afterwards. Because what I really loved about it was that you could help improve health outcomes for individuals on more of a population-based level. And of course, the individual level is important too. But I was really drawn to that aspect of public health overall. And even being able to work with all of our participants in the different research projects that I've been working with, or even just of our local community partnerships that we have and collaborating with other institutions and with other partners that I've been lucky enough to work with. and seeing all the different diverse trains of thought has been really amazing, and one of the reasons why I've really loved working in this field.
Thank you. How about Natasha?
As I kind of already mentioned, I had a really interesting trajectory and it brought me into different directions all over the place. The specific Department of Public Health and what I learned there is so valuable for everything that I do now. And I love data. I'll probably talk about it a lot because it's my favorite thing of all time. I love data analysis. I just enjoy this idea of taking a bunch of numbers and making it mean something. So it's a huge skill for every lab that I've been hired in, because not everyone has this expertise in these amazing things, but I have that expertise in addition to data analysis skills and data management. And that really sets me apart in applications. And so this, again, the MPH was really a driving point for me, and I'm really thankful that I have that background.
Thank you. Melissa?
Sure. So my public health journey, I would say, began when I was 16, but I wasn't aware of it yet. I grew up with Spanish-speaking parents and grandparents, so I was always taking them to their doctor's appointments, translating for them, talking to their social workers, and it made me realize how hard it is for someone to navigate the healthcare system, especially if they're minorities or if they're people of color. There's other barriers that are involved with that. So when I came to UCSD, I was a biochem major. I wasn't sure what I wanted to do. I was like, maybe I'll be a dentist, maybe I'll pursue this, but I just really had no idea. And I met a couple of friends in my math class, and they told me that they were public health majors, and I just really wasn't sure what that was. They explained to me more about what public health was, so I decided to switch my major, and I really fell in love with public health. It exposed me to all the health disparities going on that I've experienced, that my family has experienced. And it made me realize that we need more people of color advocating for underserved populations, not only in public health research, but also in the business side of healthcare, which is something I didn't figure out until like my last 2 years at UCSD. I did a lot of public health research and addressing health disparities, but there's also other positions in health administration, such as, operations, strategy, staffing, and it made me realize there should be more people of color in those big leadership positions, because they're the ones that are hiring our physicians. They are the ones who are hiring our researchers. And I just didn't see a lot of women, minorities in those positions. So I always thought to myself, who's gonna start that trend of we need more of people of color into those positions? And so I really fell in love with health administration in terms of public health. And I plan to use my public health background with my health administration degree to really tackle those disparities.
Love it. Sanjana?
So my career interest in public health basically began as when I decided to major in sociology. I sort of entered UCSD with molecular biology, and I was on this pre-med track and everything. But I guess as I started to learn more about the sociological perspective of healthcare, I began to understand how health is truly shaped by factors outside the clinic. So it's things about social determinants of health, how people live, their environment they're in, their socioeconomic status. And I felt that public health is really sort of one topic or one subject area which really focuses on all of those aspects and tries to improve health and well-being at a population, at a community level for everyone holistically. So that was why I was sort of really drawn to public health. And I felt like I only realized these interests at the end of undergrad, so I couldn't major in it, which is why I decided to go to graduate school so I could truly study it.
Thank you. Dmitry?
Yeah, I would say for me, the interest started very early on in life. I'm originally from the Central Valley, a really small kind of farming community there. Growing up, I always noticed just like really high rates of chronic diseases, diabetes, heart disease. Like never, no one really talks about like, why are there more cases here versus other more like populous areas of the country? It wasn't until I got to UCSD I learned about social determinants of health through urban studies classes, and kind of was able to put terms to what I was observing like throughout my childhood. That just got me very interested in the thought of prevention. Like, how can we stop this from the start? Like, why do we have to deal with this already down the line? What can we do at the beginning just to help you early on in life? When I got into medical school, I learned about a specialty called preventive medicine, where it's a combination of both public health and medicine, where not only are you a clinical physician practicing in the communities, you also get to play a role with government agencies, both local and state, to help design these kind of preventive measures on like school-based and community-based levels. So I thought it was just a perfect kind of coalescence of my interest in how to really give back to my community in the best way I can.
Excellent. Well, you all have shared so much, and I actually think that you've pretty much answered the next question that I had sort of planned to ask, which was how you picked your concentration within the field of public health. I don't know if anyone had anything that they kind of wanted to add on top of what you said, but you all said it so brilliantly that I think we're gonna move on. So I think that the next question is super relevant, especially to a lot of our undergraduates. We get questions about experiential opportunities so frequently from our undergrads. So if you think back to when you were an undergraduate, what experiences did you have when you were an undergraduate that helped you to kind of prepare for your graduate career? For those of you who are in your second graduate program, you might even think back to your experiences in your master's program as well, that would help you to prepare for where you currently are. Because I think that it's always a concern for students whether or not they're preparing adequately for the graduate programs at hand. So Melissa, I saw you nodding your head. Do you want to get started with us?
Sure. So I was thinking these thoughts not even like less than a year ago, and I think it's something very scary. And it's like you can't really compare yourself to other people's experiences, because your own experience is what's gonna drive you to graduate program or seeing what you really want. But some advice I have is to really learn how to network and build relationships with your professors or industry leaders. I have always been someone who emailed my professors or talked to researchers and senior leaders about their roles and why they like their roles. And you do so much of that as a grad student that it's really good to pick up that habit of, I'm going to email this person today, and if they don't respond, it's okay. But for the most part, and I know it seems very overwhelming, but they want to talk to students. They want you to reach out to them so you can learn about their role, because they want to shape the future leaders in public health and in health administration. So the more comfortable you feel talking with others, the easier it'll be in graduate school. You'll find out that public health and health administration is a very relationship business driven. So in terms of internships, there's no perfect internship for public health or for health administration. A lot of my fellows at my current graduate program, not all of them were in healthcare. A lot of them were in supply chain. But the reason it matters why you want to get that degree. So you can turn any internship, any opportunity that you've done public health focused or health focused. Especially trying new internships, you're going to be exposed to so much, and you learn a lot about internships, and it's definitely a time to ask questions. I mentioned that I did a public health research internship increasing access to cancer screening, which is where I found a lot of my interest in health administration. So I found out that I didn't want to do intensive research, but I told one of my faculty members, hey, I really like health administration. Is there any opportunity for me to explore this option more? And so he gave me an opportunity to work under his department. So always looking for the best opportunity to learn and be challenged, be open-minded, and going to graduate school with some experience will set you up for success, and not being afraid to take risk. I think during undergrad, I was always scared to try new things because I didn't want to fail, and I didn't want to seem like a failure. I wasn't good enough, but that's the only way that you're going to be successful and learn, is to just really put yourself in vulnerable positions to learn and challenge yourself.
Thank you. Sanjana?
As an undergrad at UCSD, I was part of SHA, Student Health Advocates, which is a club, and I found that to be my absolute favorite experience at UCSD. I loved the community of people. I loved how passionate everyone was about public health, and most importantly, I think my favorite part was how students are sort of paired with an advisor, and typically all these advisors have an MPH degree, which is how I learned about, I guess, public health as a career option. I was part of general health, so our advisor was Renee. has been such an incredible mentor to me. And she really encouraged me to pursue a career in public health and essentially opened my eyes to like how public health truly works in the real world, how big of an impact it can have on people. So yeah, that was definitely my favorite extracurricular defining moment for me at UCSD.
Love it. I every time we do these panels, I just absolutely love hearing about what everyone did, because it just makes me so excited for all the opportunities our students have. So thank you. Dmitry?
I would say for me, what's really helpful is just, again, kind of like echoing what Melissa was saying, just utilizing office hours, talking to professors. They are the experts in this field. They know about resources, they know about the research, they know about kind of the different career trajectories that we have opportunities to as we kind of begin our educational careers. For me, was helpful too, is a lot of the professors in public health, at least initially, were also medical school professors. So by talking to like Dr. Michelle Johnson, Dr. Ryan, they kind of helped gear me towards like, oh, like here's some career options that you can pursue. Like they told me about UCSD's medical school program. They told me other programs that they would also recommend based on like my interests in primary care. And just like establishing those relationships early on, you're able to not only learn about career opportunities, but also get layers of recommendation from them later on once you need that for graduate school because you've already established that relationship with them. So just take advantage of that as early as you can. Make sure it's a genuine interest though. Don't just show up because you think you need a letter because like you're trying to just like check a box application. Like talk to them if you have a genuine interest only. That way it's sincere and actually comes from a good place. Yeah.
That's great advice. Natasha?
I agree with what all the other panelists mentioned. I think those were all very valuable elements of your experience. For me personally, it was a lot of field work. All these internships that I was part of, I still communicate with all the PIs, the principal investigators that I worked with years and years ago, and now we're working on projects as co-investigators. And I call on them when I have questions, or I just actually, before this, I had a meeting with the geneticist that was referred to me by someone else. And it really is a community in the research world. And I really valued that. So I encourage you all to take as much research experience and internships that you can, because it really helps.
Thank you. Brianna?
Yeah, so everybody touched on a lot of the same similar topics that I would mention. One thing that I did want to highlight especially is not to be scared of reaching out to different professors or other faculty that you are interested in speaking with or interested in the kind of work that they're doing. I know that's something that I really struggled with in my undergraduate, and it wasn't until I got to my master's program that I really became more comfortable doing that because it seemed scary. They had a lot to do. They had a lot of students that they were working with, but as mentioned before, generally faculty are really open and excited to talk to new students, and especially given the breadth of different work that's being done at UCSD, there's so much that you could be involved with on different levels. I also want to highlight just different extracurriculars that you could be doing, whether it's different clubs that are involved in some kind of an initiative, even running different events. I remember running like a blood drive, which sounds not that big on campus, but it's like those little experiences are beneficial to help improving what your skills are, what your knowledge base is, understanding what gets involved in kind of putting these things together that helps you in the future if you ever want to run research or if you ever want to direct a team on healthcare administration. So that's something to really consider. Another thing that I kind of wanted to highlight too, and might be mostly beneficial for some of the older years in the undergraduate, especially if you're looking for some like career opportunities between grad school, is looking on LinkedIn and sending like quick networking meeting like messages to different individuals that you're interested in their work or their topics is also very helpful. Talking to people in the industry that you're looking for, other public health professionals, to just get a quick rundown of what they think of their job, asking very pointed questions, and keeping short meetings like 15 to 20 minutes is always great because it shows them, it puts your name on their radar in case anything comes across their desk that you might be a fit for, but also it is quick enough where busy people will still have time for that.
That's a great idea. And I don't know if our students actually know, but you are able to go in and see about alumni from UC San Diego, which is usually a pretty easy thing to do, to reach out to alumni from UC San Diego on LinkedIn. Many times we've had students that have reached out to various alumni and they've actually been able to connect with them. They're working within a field that they're interested in, and then kind of get their questions answered and things like that. So that's a great point. Thank you, Brianna. So now I would like for all of our panelists to think back to when you were applying for your graduate program or graduate programs. My question to all of you is, how did you decide what graduate program you were going to be attending, what graduate programs you were interested in applying for, and what resources did you utilize in your search for a graduate program? Because we have a lot of students that ask questions about, where do I find the information that I need? How do I narrow things down? So if you can tell us a little bit about the resources that you might have utilized and the things that you found most valuable in your search for a graduate program, that would be enormous for our students. Perhaps we can start with Sanjana.
So I guess in terms of searching for a graduate program, I found it kind of hard because I didn't major in public health in undergrad. So I was taking this huge leap of faith by choosing to go to graduate school in public health. So I was kind of scared. I was like, oh, I don't have a degree in public health. Is this gonna are people not going to take me? I don't know. So I guess the only reason I did choose to go for it is because my professors encouraged me. They basically said be genuine in your interests and talk about it in your personal statements, and do explain all the research or experiences or extracurriculars or classes or anything that you have taken, and really put that out there that you are a strong candidate for these degree programs. And that's essentially why I decided to apply. I guess in terms of resources, which I used, I really did talk to my professors and mentors first before applying, and what programs, I guess, catered to sort of my interests. I was interested in health communication and health education. So I wanted to apply to universities or colleges which had programs or classes for that particular topic interest.
You. Dmitry?
Yeah, when I was applying to graduate school, I found the most useful was I was thankful to have a large group of friends who were also in different graduate programs kind of around the country. So instead of just reading on the website what the programs had to offer, asking them directly, you kind of get both the information on the website saying oh, here are the concentrations they offer, here's what the courses are like, but also you get the student perspective. Instead of just reading on the website, the little testimony you can hear in person, they have XYZ, student support services. They really value student learning. There's mentorship opportunities through the program. So now I was able to kind of narrow down which schools I thought were the best fit, just based on what I was looking for long term. So when possible, reach out again through the alumni network to see where did prior UCSD alumni go to graduate school, reach out to them so you can get their perspective on which programs might be the best fit for you, regardless of just using a website or kind of other brochures.
Thank you. Brianna?
Yeah, so I feel like my process was a little bit different when I was applying to my master's program versus my PhD program. And in my master's program, I mostly did it solely was based on internet research, where I was trying to figure out what kind of graduate programs that I was looking for. And it was a lot more diverse a choice for that aspect, because I kind of similar to Sanjana, I was kind of trying to figure out what was going on with the programs and seeing what kind of research a lot of these institutions were kind of focused in on, or just trying to identify professors that I might want to work with at that time. So I know for some of my programs, when I was applying, I did reach out to those professors, and for other programs, I didn't reach out to those professors, just to say a quick hello, I'm interested in applying. Are you taking new students? Is this something that I could potentially work with you if I get accepted? And especially what I noticed in that application cycle was that the schools that I did contact, I had a higher likelihood of success for the acceptance rate. And that was especially true for PhD programs, because PhD programs are very based on whether you have a mentor-mentee relationship that would be beneficial research-wise or even interest-wise. my program is very research focused, which is a little bit different than if you apply to like a DRPH, which might be more healthcare administration type foci. So for my PhD, it was a lot of mostly speaking with other professors that I was interested in their work and kind of talking about shared interests, my past experiences, how it could help contribute to that team, seeing whether they were accepting new students. But another thing that sometimes I feel like people might overlook is speaking to other students in those programs too. Is a great way of doing it. And that's also where LinkedIn can come in again. I'm a huge advocate of LinkedIn. And it's mostly if I can't find contact information for other current students or even going through admission coordinators, you could kind of ping them on LinkedIn and just say, hey, can I just have a quick conversation with you about the program, what you like about it, what I might be cautious about, things of that sort. And I've had some great responses from that as well.
Thank you. And Natasha?
I think my experience is a little different. I didn't mention in my intro, but I'm French Canadian. I'm from Canada, but I grew up in Hawaii. So I'm this strange education from this frozen cold tundra to this beautiful tropical paradise. And in Hawaii, life was great. I did my undergrad there. I was planning on staying, but I was told that, I really should go to what we call the mainland, US continent, to get advanced degrees, right? So I didn't really know where to apply. There was all types of master's programs. I didn't travel much in the US mainland part. So I sort of just looked online and said, what kind of community or climate or area in this country could I, see myself living for a long period of time? And I found UC San Diego and I found California, and it just seemed like the best fit for me. And then I got here and I realized I absolutely love it and I'm never leaving. And my family's still in Hawaii and I've been here 10 years. So, you just never know. But I think, as what all the other panelists mentioned, just kind of do your research, talk to students, talk to professors, reach out to people who've been through the process and see how that goes. But at the end of the day, it's a pretty unique experience, I think.
Melissa?
Yeah, so first I want to say that I agree with Brianna in terms of LinkedIn. If you can get anything out of this panel, is to build your LinkedIn network. That has helped me so much in terms of like my career and professional development. But so I didn't mention this, but I'm a first generation college student. So when I was looking at grad programs, I was kind of on my own. I wasn't sure what to do, but I was lucky enough to have a mentor who actually told me, hey, like let's look into your future. Let's apply to MPH, MHA programs. Towards the end of my junior year, I worked with him for a full year. And so having a professor or a mentor who can help you navigate your search and guide through your personal interests is very beneficial. And having like that support system and reading your personal statement. And my mentor actually went to Cornell for his bachelor. So I never knew about Cornell's MHA program or any out-of-state programs. I was planning on staying in California because I was born and raised here. Didn't really know anything else, but having mentors who can push you and make you feel uncomfortable is very beneficial in terms of your growth. And I want to mention too, it's very key if you're interested in an MHA or MPH, PhD, reach out to students via LinkedIn or reach out to the department admissions directors and tell them and email them, hey, I'm interested in your program and do you want to speak on the phone? This will get your name on the radar and they will remember you. So as of now, I'm a student committee at Cornell in terms of their MHA admissions, and people who reach out to me or people who reach out to the admissions director, they remember your name. So if you can start early, they're going to say, hey, this person reached out to me a year ago and they're still interested. I want to talk to them. I can see that they're really passionate about this program. And I would say prior to those meetings, really get to know yourself, your motivations, why you want to pursue a graduate degree in the first place. There's a lot of information online in terms of the different graduate degrees, but learn more about the curriculum, what the programs are like, how are the students. The best way to really know where you belong is to talk to students and see how they talk to you, the culture. Do you think that you belong there? But I would say like it's key to really talk to admissions directors about your interests and what they can offer you.
Thank you all so much. So the last of my questions, and then we'll get to some student questions that got sent in to me. The last of my questions is, what advice would you give students searching for a graduate program? Now, I know you all kind of gave a little bit of advice already. This is specifically about how to choose a program that best meets their needs. So I know that you'd given advice about how to kind of search for a program. How would you suggest that students choose? Let's say that they've got offers from 5 or 6 different programs. What's the best way to make that choice? Dmitry?
Yeah, I would say one big factor, actually, it seems kind of trivial, but I think location is a big deal. If you're spending a good majority of your time there, whether it's a master's or a PhD program, you want to enjoy where you're at. So San Diego, for example, great place to end up for graduate school, really, another city like that. If you have like multiple options as well, kind of, you can also weigh in the cost as well, might be important. If you don't have a lot of financial means for that, see which ones will offer more scholarship opportunities, what has fellowship opportunities. And then just kind of the biggest thing also, like where are the graduates from that program ending up afterwards? Which jobs are they having after they finish their MPH? Are they working in government? Are they working in community settings? And then see how that aligns with your future career goals, and see which program and then will align with your kind of trajectory from there.
Thank you. Sanjana?
I think similar to what Dmitry said, I think that different programs and sort of colleges lead to different career paths, sort of. So a lot of schools either do research or government or nonprofits or global organizations. So really looking into what alumni have gone to, what opportunities the school offers for you to get there, sort of what professors are interested in. If you're interested in research, do they have research opportunities or assistantship positions available for you to gain that experience? So I don't know, I think it's sort of a myriad of factors to consider, but essentially whatever you're interested in, do you think the school really caters to that and will help you grow in that? I felt like that was basically how I chose my program.
Thank you. Natasha?
Again, I agree with what everyone else said already, so I won't add to that too much. I do think it's helpful to sort of look at some of the websites for these programs and look at their updates, what kind of research they're doing, what kind of achievements the school has accomplished, and see if that's, again, in line with what you're interested in, because there's a lot of great things that can come from an academic institution, but is that sort of where you see yourself in the future as well?
Good point. Melissa?
Sure. So some advice I got when I was applying to grad programs was to think about location. I know this was mentioned before. So would you be happy there? And I think something with me, I was stuck on 3 programs, and one was in California, one was in Michigan, one was in New York. And I knew I would be happiest in California, but I also knew that I had to get away from, where I was born and raised my entire life, and see where I was going to be challenged. And so it's like 30 degrees right now in New York, and I'm freezing, and I've never experienced that, but I also think it's going to make, I learn a different culture, different people. And I'm kind of alone, and I don't have family to rely on, and that's going to make me stronger long term. And I know I can always go back to California. So I would say location is a big part. If you don't think that you can handle being away from home, or even being in cold weather, because your mental health really matters in terms of program. I would also say to look at where alumni are going, and not only that, but see how alumni interact with current students. Are alumni, recruiting? Are they coming to talk to you about their jobs? And lastly, I would say look at the resources that you're given as a graduate student. So when you arrive on campus, what opportunities are there for you? I knew that I wanted a family feeling. If I was going across the country for grad school, I needed a strong, tight cohort that was going to be there for me when I was feeling challenged. I needed, my directors to be there for me. And so I prioritize a lot of feeling happy and sense of a culture of a family. And I think it's important for you to really think, can I be there for 2 years? Or even if you're doing a PhD student, can I be there for 7+ years?
Thank you. And Anna?
Yeah, so everybody brought up good points. I also want to highlight location because I feel like my experience was a little bit different. I am a Southern California native, but I did go out of state to Indiana, of all places, for my undergrad and graduate school. And I know when I applied to my master's, I felt like location wasn't as big of a deal for me because I was already out of state. I was still kind of in my exploring phase, which I was totally fine with living in other states, getting some more experiences. The winters are hard. It was very hard, kind of echoing what Melissa was saying. But it was still, I loved the experiences that I got being out of state. But once I came around to the point of applying to my PhD program, I had been out of state for about 10 years and I was just ready to get back. So a majority of my programs were to come back to Southern California. And because I knew that it was going to be a huge investment of time, it's going to be another 4 or 5 years potentially. And I wanted to be somewhere where I would have my family support again, which I didn't really have access to elsewhere. So obviously it's kind of identifying what are your needs at your stage of life and what you'd be comfortable with and going to. Another thing that was super important for me was support from that graduate program, whether it was different opportunities. Let's say for you, like the UC system has a ton of opportunities for different research funding grants they receive, training grants that are potentially available for students that might not be available at a smaller institution, and not necessarily saying that that smaller institution should automatically not be included, but it's just a factor that you should take into consideration when you're thinking of which graduate school to attend. Another thing is one thing that I really like talking to about this current students in the program was how did those departments support them throughout the process? Was it easy to get help when they needed help? Was it easy to talk to professors when you needed extra help on your research questions, anything? So that's something that I did when I was looking at different programs in Southern California for my PhD program, to kind of decide like, okay, yeah, UCSD is where I feel like I'm going to get the most support and has the type of faculty that I want to work with and the departments that I think will be helpful for me at this time.
Thank you. So now we're going to get into some of the questions that I got from students. Now I apologize to all of our panelists. These weren't questions that you heard before. So I also want to encourage our participants who are here. If you do have questions, please do go ahead and put them in the chat and we will do our best to address them. And I'll be happy to read them, or go ahead and raise your hand. Here we've got like 5 questions and then we'll be happy to answer some additional questions from students if they come up. So this first question is kind of a doozy, and I'm actually kind of surprised that it wasn't part of our original set of questions. So the question is, why did you decide to go to graduate school at all? And for those of you who have more than one graduate degree, what made you decide to pursue multiple degrees? So I see lots and lots of head shaking here. Maybe Brianna, you're still on my screen here. Do you want to get us started?
Yes, of course. So I guess a couple different factors went into my deciding to pursue a master's to begin with. First is when I was kind of taking a look at different job opportunities coming out of my bachelor year, just looking at what the preferred requirements were for a lot of the kind of positions that I was looking into was a good indicator that, hey, a lot of these, to be competitive, a master's is definitely beneficial. And also my undergrad was in biology, so it was a lot of like lab-based work that my experiences were a part of, but I really wanted to have that public health training, including getting some epidemiology courses, more biostats courses, theory courses, things of that sort that I didn't necessarily have in my toolkit, basically. So I understood that I'd be able to get that in graduate school that would help me to be competitive on the job market, because I felt that after that master's program, I would want to work a little bit before I went back to school. And then for my PhD program, the reason why I wanted to go again is for certain things I kind of felt like a top out in skill. And also I primarily worked in like clinical research coordinator, program manager positions at academic hospital systems that were attached to medical schools. So the first was at the Icahn School of Medicine at Mount Sinai, and the second was at the University of Virginia in Charlottesville, Virginia. And in those different roles, I had a lot of different experiences, both regulatory, but also project implementation. And especially when it came to like doing the research, like running different data analysis plans or implementing different theories, it definitely felt like there was something behind the curtain that I just wanted to learn more about, or like there was other skills out there that I wanted to get training in to like master that and be able to answer some more of those like public health questions that I was really interested in, but I just didn't have the tools to do at that time. So that's something that really drove me to going back to get my PhD, to get that extra training. And that's another thing that I looked into at the programs that I was applying to, is what schools have the kind of curriculum that I'm looking for, or implementing the methods that I'm really interested in, and kind of helped me drive or get me here to UCSD, basically.
Thank you. How about Dmitry?
Yeah, so for me, when I first came to UCSD as an undergrad, I knew I wanted to go to medical school long-term at some point. I graduated from UCSD in 2016, and I took 2 years off to work in clinics here in San Diego. I worked as a scribe and technician at a neurology clinic here for 2 years. By doing that, I kind of learned that, okay, I definitely do want to go to medical school. I didn't want to rush into anything right after undergrad, so I wanted to like get some patient care experience first, see is this the actual like, right career path for me. It definitely was after I had those 2 years of experience. And while in medical school, again, we have a very strong focus on social determinants of health and public health in our medical school as well. So I was kind of reintroduced to those concepts I learned in undergrad in my public health major. And that kind of taught me that, you know, I need an MPH to get this additional training so I can actually work in what I want to go into long term. For most preventive medicine fellowships, they do require an MPH either at the same time as the program or done beforehand. So I thought, might as well just do it now, learn these skills right now, and just kind of tackle everything as I can before I finish up medical school.
Thank you. Melissa?
Sure. So I applied straight from undergraduate, and I think that has its pros and cons. Honestly, I wasn't sure what I wanted to do or where to apply to jobs. I didn't even know what kind of job I could get with my degree. And I also applied when it was COVID-19. So you know, jobs were scarce, and everything was up in the unknown. You didn't know what was happening in healthcare, and so I thought it would be a good opportunity for me to get a master's. I knew I wanted to get one. I didn't know when, but I just thought like the timing fit perfectly. Especially now, like with COVID, like you learn so much about health disparities and health administration, what we can do better. So everything kind of aligns for me. But if I could go back in time, I would say to maybe take a year or two off, only because when you take a year or two off, you get to really know what you want to do. You have more exposure to the real world. You're able to apply more and discuss more in class, because I have a couple of my friends who took 2 to 3 years off, and they have real hand experience in healthcare. They can actually apply and talk about, you know, their experience. But I just think it's something that I just never knew that I could do right after undergrad. I didn't know what kind of jobs to apply for. And with COVID-19, it just kind of made sense for me to, let's go get a master's, because I see the value in it now, especially because of COVID-19. And I think a lot of master's programs, especially MHA and MPH programs, they want people straight from undergraduate now, because I think like there's so many opportunities for you to do internships and be involved in clubs. But I would say if you're hesitant, it doesn't hurt to take a year or two off. It's not going to be the end of the world. And I know sometimes we like to compare ourselves to others, like, no, I have to get the master's degree now, I'm going to fall behind. But I promise you, a year or two is not going to make the biggest difference in your career. So just take your time and go to graduate school when you really feel like you know what you want to do.
Great advice. Natasha?
Yeah, I had an interesting process. So I got into my master's program, and that was great. I was learning so much, and it was so valuable. And then I had this moment of what next? You know, what do I want to do next? And so I started working in clinical trial research, doing neuro clinical trials and breast oncology clinical trials. And I could have stayed there. I could have continued in the clinical track and just done clinical trials, and it was great. I learned so much, but I thought long and hard about what I wanted to do long-term. And I decided that I wanted to be have my own lab and run my own lab. And in order to do that, I needed to get a PhD. So that was the decision that propelled me to move into the next step. But I could have been perfectly happy staying with the master's and in the clinical trials and doing what I was doing at the time. So it's really a personal choice, but it didn't come to me right away. It was all kind of this stepping stone process as, okay, got my undergrad, now what? Okay, I'm gonna do this master's. Wow, I learned so much, now what? And then it just kind of moved in that direction over the last many years. Actually, I'm aging myself, but it's been a lot of years.
Okay, I understand. I always joke with my students because I was an undergrad here too. And so I always like, well, I'm aging myself. Thank you. Sanjana?
So like Melissa, I also applied for my master's right out of undergrad, and I knew that I wanted to work in clinical research, and I do still want to get a medical degree, but I felt like with my medical degree and with a public health master's degree, I would be able to do clinical research, especially because, well, that was something that I've always known I wanted to do. And also I go to Hopkins, which has a very strong research sort of focus, which is also why I chose the school. But I felt like that was how I was going to get to where I wanted to be.
Thank you all. Now, I don't know if this is something that all of you can answer, so please do, panelists, just jump in if you have an answer to this question. This again came from students. The question is it logistically possible to work while attending your graduate program? And what I know of a lot of grad programs, it's usually not, but this is a question that we got from our students. So Natasha?
Yeah, I'm going to jump in just because I worked all through undergrad, all through master's, and all through PhD. I've always worked, but the positions that I held were adding to my education. So these would be, in undergrad, it was working at the medical school in an admin position, but I worked at the medical school. So I sat in on all of these appointments with all the physicians, and I listened to them talk every day, and I wrote down minutes. And so even though I was just working in an admin position, I was learning as I was in that field or that process, I guess. In my master's, I did many field work projects. I worked in HIV and Hep C and tuberculosis and neuro and cancer. And I really just put myself out there, and I would do anything because I wanted to learn everything. So I'm a huge advocate for that, but the job you take matters, right? You've got a big coursework, you've got a lot of responsibility. If it's going to start impacting your education, then it's not doing what it's supposed to do. But if you can get class credit or find some financial compensation that works with your program, I'm all for it.
I can jump into, during undergrad, I worked all 4 years. I worked part-time. I never worked full-time, but I did get class credit for certain projects. You kind of make it work, but I think for graduate school, there's two scenarios. So I have a friend who is working full-time during her MHA degree, but she's not involved in any extracurricular. She's not actively recruiting or looking for jobs because she knows that health insurance company is going to hire her after graduate school. But with me, I work part-time. I work remotely for Kaiser Permanente 10 hours a week, and they understand my schedule. I'm also involved in clubs, and I just think it's like, what are your priorities, right? Like, do you want to go to school and work more hours at a job, or do you want to be involved in clubs? Do you want to network? Do you want to take advantage of all the resources that you're going to have as a student? So I would say that it's doable to work part-time. I've never worked full-time, so I can't really speak to that. But I think graduates, it's expensive. And I know, like, my graduate program, I'm a TA for 10 hours a week. So they try to help you out, and looking for jobs that know that you're a student is very beneficial if it's remote, or if you're getting class credit for it. I think it's doable, but you also have to be careful of like what you want to prioritize as a student, because you're only going to be a student for 2 years. You really want to soak in all of the resources that you can while you're there.
I could jump into, because it's definitely something that I worked throughout my undergrad and both of the graduate programs. And I've also seen, similar to what Melissa said, it's like you really have to you only have an X amount of time and you're really going to cut the slices the way that you want, basically. And it's identifying the pros and cons that come with both of them. And the more hours that you work, the less you might be able to do those like extracurriculars on the side. But I know that I tried to, I found, especially during my undergraduate program and my master's program, and even now, I feel like if you can find on-campus opportunities that are like part-time jobs, I found those to be the easiest to handle while you're in school, just because there's already an understanding that like they know you're a student, they know what the school schedules are like, when your finals week is, things of that sort, and there's a lot more flexibility. I'm not saying that it's impossible to do anything else. I mean, I worked at Pier 1 when that was still around through my graduate school. And also I felt like the more experience that I got in different roles, and this is ranging from like working at Starbucks, working at Pier 1, to starting to work on like side research projects with different investigators and things of that sort that are paid. Now, if I'm going to pick up like an extra like side job, like 10 hours or something, I want it to be something that could add to my resume or that I could build skills from. Versus I feel like when I was in an undergrad position, it was a little bit more difficult to do that, that were paid opportunities. There was a lot of volunteer opportunities available, but kind of as you kind of rise in your education career, it's easier to find those and leverage what you've already done and your skills to do things that can improve your resume, but also help you have some more money on the side.
In general, also, I would say it definitely depends on the program. I know for medical students, it's recommended we do not work, and I don't think it's even possible, honestly, based on my own experience, just given the kind of coursework and the clinical requirements. For the master's program now, I think the schedule is a lot more flexible, allowing people to work. Most of my classmates have part-time jobs. For me personally, I'm working as a TA for undergraduate UCSD courses. I would say it is possible. When you're first out of graduate school, definitely adjust first. Kind of maybe don't get a job right away, but adjust to the coursework, get to know your schedule. And then once you kind of have a good basis or a good ground of what's going on, then add something on. Don't just kind of jump into everything at once, because you'll find it difficult to balance everything. But I think a part-time on-campus job is definitely key for graduate students, especially for TAs. It gives you the opportunity not to only get paid, but also just network professors who can always help you out, like down the line for career opportunities, research, or just help with like for committees for thesis or a capstone project.
Oh, that's an
Even
excellent
recommendation
point.
letters.
Yeah, that's an excellent point, because that really will be a great way for you to get to know faculty. Yeah. Well, thank you, everybody. We have some more questions from students that have come in. One of the questions that we had, that I think might, again, not necessarily apply to everyone, because not all of your graduate programs have the same expectation for research. But what is your advice for students who are interested in graduate school who have a limited amount of research experience?
Okay, I will share. It's kind of similar to what I already mentioned about getting that experience, that field work, or just reaching out to people and seeing what you can do. Again, if you're overwhelmed with schoolwork and it's going to take, get into that situation, maybe not the best time, but all of my contacts that I made in my undergrad and master's and PhD, I still work with today and very closely, and I built relationships with them. And so we talked about this a little earlier. Those relationships really matter, especially if you continue in your career. Even if you do go to another institution, they'll still write you letters of rec, they'll still support you in applications and other things. So yeah, I would just really try to work on your resources and focus on those people that are around you.
For myself, during undergraduate, I wasn't really involved in research as much, especially public health research. It was mostly experiential learning that I experienced. So it's like being involved with different clubs, running different events that we had on campus, whether it was like raising money for our brigades by like organizing a, we called it the Night Glow 5K, or like running a blood drive, or even talking about my experiences. And like a huge aspect is focusing on how your experiences and your skills can be translated into the research setting. So identifying out of the things that I've done, what skills can I use that would help me contribute in your lab? Or I've been exposed to, I don't know, like for my undergrad, when I went abroad, it was a lot of focus on like antibiotic use in South America, which is a lot higher than it should be. That could potentially lead to increased antimicrobial resistance. And I just talked about being in the setting about that. And that was actually what my master's capstone project was. And I basically just used my past experiences, leveraged what I had done and like kind of reformatted it and to describe how it could be helpful in research and why I'd want to run research in that. So that's definitely something that you could tie in for yourselves.
I can add, I think it's also how you market yourself in terms of, I don't have this research experience, but I want to be a researcher. I want to learn more and I'm passionate about this. I'm motivated because of this. And I think a lot of graduate programs are starting to realize that skills can be taught, but passion and motivation cannot. And so when you market yourself like you're passionate and like you're never going to give up, because when you're motivated by something, programs know that this person will never give up because they're here for a reason. So somebody can have all of the analytical skills in the world and be the best researcher, but if they don't have a passion, then they're going to get burnt out. And I think when I was applying to grad programs, I didn't have a lot of, I never worked full time, but I marketed myself in terms of, I'm here for this reason to increase access to minority populations because I've experienced this, and they see that passion and they know that you're never going to give up. So I think it's like the way you leverage yourself is really, really important. So it's easy to compare ourselves to others. Like they have more research than me, they have more experience, but you might have more passion. You might be more driven than them. So really advocate for yourself and don't feel like you're not good enough only because you don't have that experience.
You guys are so fantastic. I just love this panel. It's amazing. So I've got a couple more questions from our students. We had some students that were interested in hearing about graduate practicums. Now, I'm not sure how many of you have participated yet in practicums. But if you have any experience with graduate practicums, if you can describe what it's like, that would be really helpful for our undergrads to sort of visualize what they might be looking at.
I think we don't really I don't call them practicums. I just call them internships. I think we agree that's one and the same, or is it a difference?
I think it probably depends on the program itself.
So
it's fine as long as it's something that you did like in graduate, like an experiential thing that you did in graduate school. I think that'll be,
yeah.
Well,
similar to what I mentioned before, I saw this, on the listserv, there was an ad out for some research experience, and I didn't get paid or anything. I just went to this lab and I learned some amazing skills, and I used all of those skills based on epidemiology, data analysis, et cetera. And I used that towards my master's thesis. And the person that I worked with, the principal investigator on that study, wrote me all my letters of rec for my PhD, and we still work together in the future. I know I sound like a broken record, but it really is what happened, right? I found this random ad, I showed up, did the interview, I was given the opportunity, and that was the biggest stepping stone that I had in my early MPH career. So I really am all for the practicums / research experiences.
Jumping off of that, my program has a 1-year practicum built into it. So this is my 2nd year of schooling. I'll just be working at some place or doing an internship. And I think that it's really helpful because I've heard from a lot of students that you apply everything that you've learned your first year of your school. And it also helps you if you want to get a job or if you want to do a PhD program, you can gain research experience during that 1 year where you basically have sort of time set aside for you to figure out what jobs you want, what career opportunities you want. And I think that that time is also really crucial to get letters of recommendation, develop contacts, and things like that.
I think for me, so since my degree is not very public health focused, it's more health administration. we have opportunities to be involved in case competitions. And so those are when a hospital gives you a real life problem that they're going through. Let's say, during COVID, we had high telehealth services utilization, but now they're going down because people are going now in person. What can we do to leverage telehealth to our population, to underserved communities? And so then you get a group of 3. So I did 2 this semester so far, and you have like either 3 weeks or 1 day to make a whole PowerPoint, leverage all the solutions, all the skills, do market analysis, and then you present to the administration of the hospital. So I think that teaches you a lot about how hospital systems work, finances. And I know UCLA has a case competition that I'm not doing, but I have other friends in my program that are doing. And I know UCLA was saying, how can we expand our healthcare services to underserved populations? And so my friends had to think of 3 solutions in the span of 3 days and present to the senior leaders. And I think that's something that you don't really get in terms of coursework, but you're applying all of your coursework to that case competition. So when you're in grad school, look for those opportunities where you're gonna be vulnerable and be not really know what's going on, but you're gonna learn and work in a team. And I think in the real world, you're gonna be working in teams your entire life, and it's something that you should start getting used to in terms of how do other people work, how do people manage their time, and how can I be around that environment? How can I be a better team leader?
Melissa and Sanjana, just out of curiosity, I know that you both just graduated. Oh wait, Sanjana, you weren't one of our undergrads in our program though, right?
Yeah.
Okay, so Melissa, I know that you probably participated in the capstones. Sort of what you did in the capstone, did that sort of feel a little bit maybe like it might lead into what you're doing now?
Honestly, it did. And I think when you work in a group for so long, the entire year, like the last 2 semesters, you really get to see how people work. And I think in terms of healthcare and public health, you're going to be a leader one day. You're going to have to see how you can leverage people's skills. You're going to see, how does this person work? How can I be how can I use that person in terms of like maybe they're not comfortable doing this, but how can you push that person? And I think being a leader is really expanding people's potential. And that's something I saw a lot in the capstone, is like you really have to take other people's opinions and work in a team. And that's what healthcare is about, right? Just working in a team, trying to find how people work. And in terms of the capstone, I found it very relevant only because you present with those people, you build a poster with those people, you have to agree on all of the same solutions. So I wish it was longer. I wish it was like, I know honors practicum is 3 the whole year. So I wish ours was a 3 years, was a 3 semesters too.
You. Yeah, I feel bad kind of putting you on the spot there, but I think the more that you were talking to me, I was like, oh, that sounds a lot like the capstone. So I wanted to check and see. Perfect. Well, then this is the last question that I have from students so far. Participants, if you do have additional questions, please feel free to chat them to me or to raise your hand. I will be more than happy to call on you if you want to unmute yourself. So the last question that I have is for our 3 UC San Diego people who went to UC San Diego as undergrads. So that's Sanjana, Dmitry, and Melissa. Those of you who went to UC San Diego, do you have specific recommendations for clubs or organizations that students who are interested in public health could get involved in that would be beneficial for their skill building, their resume building, their graduate school, et cetera?
I can start. I think the one I know that was starting my last year at UCSD in 2016 was just the Public Health Club, which makes sense. They offer lots of workshops on graduate school. They have speakers come in that are kind of professionals in the field, whether that be in the medical setting, in kind of nonprofit setting. So you're able to be exposed to a lot of career opportunities, hear from alumni that are also in graduate programs currently. So it's really just an overall well-encompassing resource that goes over kind of like the next steps after your bachelor's, what can you do next, or the options, whether that be going straight to grad school, gap year opportunities, research, or just an overall good resource to look into. I think they have a Facebook group that you can look into so you can kind of see when their meetings are and get their contact info.
Actually called the Public Health Undergraduate Organization now. And they actually work with the Public Health Graduate Organization, which you as an MPH student could potentially become involved with as well. So for our undergrads, if you're interested, they're called the Public Health Undergraduate Organization now. It just changed last year.
I think I was part of SHA, but I guess it's now called WPE, but you work with health promotion services and student health services at UCSD to create programs, initiatives, campaigns, and that sort of stuff about like different topics. So I thought that was really helpful for me to gain experience in public health and also just better connect with my UCSD community when I was in undergrad.
So for me, I believe in quality over quantity. So I wasn't very involved in, hundreds of clubs. I was involved in 2, but I was very involved in them. I had leadership positions all of my 4 years. And that's something that I talked about a lot when I was interviewing for grad school. They would ask me about these organizations. And so the one I was involved most was called the UCSD Cancer Outreach Team. So we would leverage brochures and cancer screening materials to Asian Pacific Islander communities because they suffered a lot with health disparities in terms of cancer screening. So I was a big advocate in that relation. But you're gonna have to remind me, Elisa, is it FMPH 198 and 199? I know they're not clubs, but
Yeah.
they give you course credit for doing like an internship or doing experimental research, correct?
Yes.
And that's something that I wish I would have known sooner. I joined my junior year. I reached out to who is my mentor now, and I still talk to him every day. He's the reason why I'm in grad school in the first place. But I reached out to him. I saw, his post on the BSPH website. But I would utilize that because you're getting course credit to get to know a professor, to do research in what you want to do. And it's not really an extracurricular or a club, but I think it's something that you should really use to like in your advantage, especially if you're a public health undergraduate.
Excellent. Thank you all so much. And I know Cassidy just reached out to me and reminded me that the Public Health Undergrad Organization actually has a general body meeting tonight. So that's at 7, and it is over Zoom. So if you are interested, she is going to write, hopefully she'll be able to write the Zoom link in the chat. But if anyone else, any of our undergrads have any, or not undergrads, we may also have grad students in here. Any of our participants have additional questions, please feel free to either write them in the chat or to raise your hand. We'll be more than happy to answer your questions.